Okay, welcome. And this is another in the series of Brain Gauge YouTube channel. I'm here today with Carrie Meyer, director of the Okoboji Wellness Clinic. I just visited out there and, several months ago, I went out and did on-site training for the Brain Gauge and they all jumped into it. And I wanted to go out and visit because I was looking at some really fantastic case studies and I wanted to see for myself. And so we're just gonna hop right into it. Say hello, Carrie.
Hi, everybody. We're so glad to be with you today. It was such a delight to get to have Mark in Okoboji, Iowa for a week. Having a neuroscientist be able to come to the clinic to actually see the technology that he created in action at our clinic and the results that we're seeing is just mind-blowing. So it's so exciting that we get to share this here today with you.
Yeah, great. I just want to go through a few of the case studies. This is just a few of the case studies, guys. It's not all of them, and it's really pretty cool. So first of all, just to give you a little, they do lots of different types of treatments, and they try to, every treatment is fitted to, that the person who's getting the treatment because everybody's different. Dr. Bradley Meyer runs a clinic. If you didn't notice, Carrie Meyer is married to Dr. Meyer, but she runs the clinic while he does all the counseling or all the patient intake. And anyway, they do the type information or the type treatments that we're going to talk about today in our case studies are hyperbaric dives, zone treatments, neurofeedback, nutritional counseling, and the Brain Gauge Gym. So if you haven't been paying attention on the Brain Gauge YouTube channel, you should know the Brain Gauge Gym does work, in terms of helping with brain fitness. So how is it being used at Okoboji? Well, the Brain Gauge standard testing is used at the initial consult and to obtain a starting point. And it provides specificity. So that's what all this stuff is. We don't have time to go into what all the measures mean. You can read about that later. But then the Brain Gauge Quick Check is used, it only takes 90 seconds. It's used before and after a lot of patient sessions. And, these are system metrics. And so that means we're not looking at tiny little specific molecules. We're looking at how is the overall system functioning. And if the system is functioning better, guess what? Your scores get better. That means you're getting healthier. So that's the quick check. Then Okoboji is great. I mean, because they took the brain gauge gym to the next level. They have a whole bunch of brain gauges in their clinic, and they use the brain gauge gym to complement the treatments. People can come in and train and test anytime at the clinic. Well,
It's this
anytime they're
really,
open anyway.
really, Mark, the cool thing is it's a standard of care. Just like, nurses take blood pressure, or they take, your blood sugar, the brain gauge, it's a measurable device that you can use as a measurement tool and also as a training tool. It's very unique in that aspect.
Yeah, it is, and it's great. And you guys have started using it like a vital sign. It's awesome.
It is. It's a standard of care here at the Okoboji Wellness Clinic.
Yeah, and like I said, it doesn't take long.
No,
And
90 seconds. It's
yeah,
very short and sweet, and you can do, the more, 15 to 20 minute in depth for those patients. But, taking 90 seconds just to get a tune up to see where you're at and then seeing the results. I mean, everybody's talking about it.
yeah, I noticed that. And we had a community talk. A lot of people came in, and the cool thing was a lot of these people, well, they drove 1, 2, 3 hours away to come to the talk, and they had bought, and some of them didn't have brain gauges, and they got them, and they were taking them home with them, and they were coming to the clinic once a week or once every 2 weeks, but they were using the brain gauge at home and getting
Yeah.
monitored by the staff, and the really
That's
cool.
one of our goals, Mark, is that not
Yeah.
only can you have the Brain Gauge Pro here at the clinic, but that you can have a home unit. So you can be putting the reps in just like you're going to the gym, and it's bringing wellness into your home. There's not a lot of devices that actually can do that. And the Brain Gauge gives people that competitive edge.
Yeah, exactly. And one of the things that was I found really cool at the community talk, I had people come up and tell me how much the brain gauge had helped them.
Mhm.
And in particular, like one person said, well, I'm not scared of my husband's driving anymore because he's actually got a faster reaction time. And so now, when your reaction time is faster, the world is going by slower. And so things are a lot easier. So anyway, it's all pretty cool. So let's go on the next thing. I'm just to give you a few examples. A lot of times you guys test before and after hyperbaric dives, and sometimes you see really huge effects, really high impacts, and that's really nice. A lot of people, the other day I was in there and it was like, yeah, there's somebody went into the chamber, he came out and he had a huge increase in brain function just from one dive. So that's really pretty interesting.
Yeah, to be able to actually measure it. It's not just how you're feeling in regards to, a whole bunch of questions, to actually get to have a measurable tool like this to show, hey, this is giant improvement within a 60-minute hyperbaric dive. And they're like, yes, I'm seeing the real live results really helps Mark.
Absolutely. And a lot of people know, I just put up a list of all the different things that we've been involved in, but in this particular case, we've the brain gauge has been we've not really met a whole lot of neurological issues that we haven't been sensitive to. But I put a little asterisk next to the ones that are in the case studies that we're going to look at. And we'll just do these really quick because case studies, as you know, you could talk about forever. But let's just pull up a couple. And in this case, this was this first person. This was really phenomenal. This guy had memory loss and early dementia, 80-year-old male, and he was not functioning very well. These lower scores are bad, but and he started doing hyperbaric dives, and then at this dotted line, he started doing the brain gauge gym religiously. The guy, he did it all the time, and now he's doing extremely well. Just to give you a number, because most people don't really know what numbers mean in terms of what our scores are, but his reaction time went from 600 milliseconds, which is really, really bad, to be blunt, to about 170. And that's really very good. So he's performing, and he went from where he had trouble making conversation to where now he's just acting completely normal. So I think, the combination of treatments on that was really phenomenal. So
Yeah, it's amazing just to see the results in something as simple as 15 minutes a day, to be able to do the brain gym with the hyperbarics thing to get to actually show visuals and results to say, look how far you've come.
yeah,
You can measure yourself with your weight on a scale, but how do you measure your brain, the brain gauge? And so for this gentleman, it was so life-changing, like you said.
yeah. We have another example up here, somebody else with memory loss, and this was just simple neurofeedback that was, and basically, and we know this, that symptom resolution paralleled improved scores. Sometimes people do the brain gauge and sometimes they don't. Or we're using the brain gauge to track them, and that's the way it used to only be used. But, it's still pretty accurate and you can see that they're getting better. And that always gives you an idea whether to switch treatments or not if they plateau. So let's go on to the next one. This is anxiety and trauma-induced behavior. In the top of the scale, we got somebody that was doing multiple treatments, ozone, hyperbaric dives, and the brain gauge gym. And this is when he started the brain gauge gym. And obviously, he's still doing all these different treatments, and he's getting much, much better. The other person, again, anxiety and brain fog, and the only intervention here is neurofeedback. Personally, I think if they started the brain gauge gym on here, she'd probably this yeah, female, she'd probably do much better. But that's just not, I'm not the physician. That's not my job. Anyway, traumatic brain injury. Now we've seen lots of data with the brain gauge on traumatic brain injury, but this is a nice case study to look at because in this case, each green arrow is when the person did a hyperbaric dive. This point here is when that person started doing brain training. Now he had
Mhm.
been doing hyperbaric dives for a long time, but when he started doing the brain training, the hyperbaric dives started having a bigger impact. I find that really interesting. So
It's amazing science, Mark. I mean, just to get to see and say, man, you put in that extra brain training in all five areas of the brain for 15 minutes, and just to see the results, and the science doesn't lie. It's right there. It's so exciting, to bring so many people hope.
it is good. It's really fun. I really love getting engaged with people that are doing this stuff, and it's really, you spend your life as a scientist writing papers, and you don't get a lot of positive feedback from that other than people saying great paper, but or sometimes they don't. Sometimes they don't like it. But when somebody says, "Hey, this really helped me," that's really cool. It's really really interesting. Let's go one more case study. Um, Actually, a couple more. This is a neurodevelopmental case in autism, and what you note here, this person was getting a lot of different treatments. He's changed his diet. He was doing hyperbaric dives, and he was also doing neurofeedback. And then right here at this line, if you notice all these little hash marks, each hash mark is when he did a training session. So we keep records of when people are doing training. And so if somebody, a lot of times if there's a big gap, staff will take a look and say, hey, this guy hadn't trained for a few weeks, and they'll jump in and see what's going on and be able to monitor it. But he's been all of a sudden after his training, his scores shot up really remarkably, and his symptomology also improved. So I find that really again fascinating. But as you know, I mean, a big issue in autism is connectivity, and the brain gauge uh, measures different types of connectivity, but it also, the brain gauge gym targets strengthening connectivity. So that's probably a really good hint as to why this really helped him out a lot. So we have a few random case studies at the end just to say, I always get into trouble. People say, sometimes you do a little presentation, they say, oh, the brain gauge is just for aging, or it's just for autism, or it's just for TBI, or it's just for X, Y, or Z. But no, it's any neurological issue. And in this case, we're looking at, positive reinforcement with the brain gauge for people, looking at high blood pressure, alcoholism, somebody gets sober and yes, their scores do get better. And again, in prostate cancer, cancer is well known to cause cognitive decline, but if you treat it well, you can reverse that cognitive decline. So, anyway, that's those. I just wanted to give you a flavor of all the different issues we were looking at. And if you want more information, if you really want a lot of information, you can come do the brain gauge workshop with me, but that's a lot more than anybody ever wants to do. But there's a lot of information, and if you want to find out more about Okoboji Wellness Clinic, don't hesitate to call. There's the phone number right there, and Carrie Meyer is always very gracious about talking to people. She's very eager to tell you what's going on at their clinic, and they have a very wide range of people they take care of.
Yeah, it's such an honor to get to be able to partner with you, Mark, and the Brain Gauge, and be able to, we have 10 pros here at the clinic. We test, we treat, and we train. It's just awesome. And then we repeat, and we get to see miracles every day here at the clinic. And your tool of the Brain Gauge has been a really game-changing tool for our practice and to actually get to show real results. So it brings a lot of hope and healing, not only in the clinic, but also to your home. So I can't thank you enough for coming out to Okoboji. If you're curious, if you're a practitioner wondering what it looks like in your clinic or have more questions, please give the clinic a call. I'd be happy to talk with you as well. And I encourage you to buy a Brain Gauge home unit because it is a game changer. We put our reps in every day, just like you go to the gym. We just put our Brain Gauge in, go to the gym with our Brain Gauge 15 minutes a day. And it's incredible, life-changing.
All right. Thank you, Carrie. I'm going to stop now and try to quit recording.